Hello, I'm Dr. Rohini. So today I'm going to talk about the complications that are anticipated after an egg pickup procedure. So one of the most common complication is that patient will have pain. So post procedure there is patient may have colicky pain or pain in the vaginal region, and this may last up to 2 to 3 days in some cases, and some women from whom we have retrieved a large number of eggs, they might have this persistent pain for even 2 weeks till they get their next periods. So that's why we give painkillers to the patient for the first 4 5 days. The next, again, another complication that we anticipate is vaginal bleeding, which may be very short lasting. It may last only for a day, but in case if it is lasting for more than a day and you're having passing clots, then you have to come back to the clinic. Some serious complications, which are not very common, they are rare, but still patients should know about this. There is risk of intra-abdominal bleeding also. So this can happen when there is any because of when during an egg pickup procedure we put a needle inside the ovary and we remove the eggs. So in some women it may happen that the ovary may continue to bleed continuously and there may be collection of blood inside the abdomen. So there are few symptoms. One is that patient will have severe the abdomen will get swollen up. They'll have headache, dizziness, and patient will feel like fainting. But usually we monitor the patient, and this in the hospital initially if there is any increase in heart rate or blood pressure, which is signs of bleeding, and we discharge the patient once we feel that the patient is stable. Now another complication which can occur after the discharge of patient, that is ovarian hyperstimulation syndrome, OHSS. So this usually happens in women who have from whom we have got a large number of eggs, that is more than 15 eggs, or if patient had PCOD from before. So in this women there is increased risk of fluid collection inside the tummy. This collection can go on increasing over time, and they may have breathlessness, they may have decreased urine output. So to prevent this, usually we tell the patient that they should take a lot of water, should have a very high protein diet, and also we start them on certain medications like cabergoline. And there's also, though nowadays OHS has become it's not very common after the introduction of injection GnRH or decapeptyl or Lupride in brand names. So when after we started giving GnRH injections as trigger, the incidence of OHSS has come down. Another complication which is very rare but we should be cautious about it is ovarian torsion. So what happens is when we give all these injections, the ovary size becomes big, and there is a chance that when the ovaries are very mobile and big, they can twist over and patient can have severe pain. The pain will be so severe and intolerable, they'll come to the hospital immediately, but they'll have nausea, vomiting, and this is an emergency. When this torsion happens, that is the twisting of ovary happens, then we have to do immediately a laparoscopic procedure or an open procedure and do this untwisting of ovaries. So how to prevent this? One thing is we tell the patients after the pickup procedure that don't exert yourself, don't lift heavy weights, don't do aerobics or very strenuous exercise, and avoid having intercourse till you get your periods. Because once you get your periods, the size of the ovary reduces and the chances of this twisting also becomes very less. So these are few complications that you should know about. I hope I was clear. In case if you have any doubts, you can come and visit us. Thank you.